He is one of the founding members of the Aravind Eye Care System and is currently its Chairman Emeritus and Professor of Ophthalmology. Dr. Namperumalsamy started his career at the Government Rajaji Hospital, Madurai. Then, after training in USA, he came back to Madurai and set up one of the greatest institutions, not only of India, but in the world today. Dr. Namperumalsamy has huge number of accolades and awards to his credit, including the Padma Shri Award by the Government of India, Lifetime Award by the All India Ophthalmological Society and Tamil Nadu Ophthalmic Association, Achievement Award by the American Academy of Ophthalmology, Dr. B.C. Roy National Award in the category of Eminent Medical Teacher in MCI. In 2010, Time magazine listed him as one of among the 100 most influential people in the world. I have spent a small while at Aravind Eye Hospital also, apart from Shankar Nethralaya, and I'm indebted to Namperumalsamy sir for my career in ophthalmology. Dr. Namperumalsamy sir, can you introduce Professor Mangat Dogra?
Thank you very much, the organizers of this lecture series. And I take this opportunity to thank the scientific committee and other office bearers of the prestigious AIOS for having named one of the lectures on my name. Thank you. It is a great honor for me. I'm very happy to introduce Dr. Mangat Dogra. He is a good friend of mine. He is a former professor and head of ophthalmology, chief of retina service of Advanced Eye Care Postgraduate Center, Chandigarh. And he has worked under Dr. Amod Gupta. He is the former recipient of the same award last year. And he has done a postgraduate MS in ophthalmology in Chandigarh. And also he has done a vitreoretinal fellowship in Maryland, Baltimore. And having done that vitreoretinal fellowship, he has come and joined in the vitreoretinal service. For more than 3 decades, he has spent the whole time in vitreoretinal services and patient services, and also is a great academician. And he has trained many people, many persons in the field of vitreoretina. And he is a great researcher, and he has got many papers on his credit, and he has at least 207 papers in peer-reviewed journals, and has written books of 4 books in his name. And more than that, he has received more than 35 awards, oration awards in the field of vitreoretinal field. And he has been the former president of Vitreoretinal Society of India. And his main work, even among the vitreoretinal diseases, his interest has been the ROP. And he is the father figure of ROP, the evaluation, management, and the proper dissemination of knowledge to the entire country, I will say that he has been. And so he is a great academician and researcher, and I am very proud to introduce him. And he is giving this endowment lecture on my name, and I congratulate you, Dr. Mangat Dogra, and I am proud to introduce you for the crowd. Thank you very much.
Dr. Mangat Dogra, sir?
Yes.
Yes, sir.
Is it my screen is seen?
Not yet, sir. Can you share this?
Let me share. Yeah, sorry.
Yes, sir. It is shared.
At the outset, I would like to thank AIOS, especially Dr. Partha Viswas is here, and the entire governing team, those who thought me worthy of having this great endowment lecture, which is named on a person whom I have just owed all my life and felt that he is a role model for so many of us, not only in this country, probably in many places in the world. I think he has been already introduced by Partha. At present, he's the chairman emeritus. And he, his education and other things is way back. He worked with Payman and then with Charles Keepens. And you can see he's the founding member of the Arvind Eye Care system, as well as so many people are trained with him. Dr. Tara Prasad Das is here today. He's another one who has been trained by him. And well, I remember when I had gone and they had invited me, he said, I'm going to only now, after my retirement and become as a emeritus chairman, focus on the research. And we know most of the B-class research is coming out of this institution today. And that is what he has focused on. And we are proud of that. And we feel as Indian proud. I think his awards already been said, I think from all over the world, as well as about his Padma Shri, as well as B.C. Roy Award. I'm really honored to have got this, and that also after my mentor, Professor Amod Gupta, delivered the first one last year. I'm also going to little bit dwell on the same subject, which has been by my earlier endowment lectures recipient. I think science is a very complicated thing. It involves so many things, so I'll not go. I think some of these have been touched earlier, so I'll just move forward. So what do we kind of know about a science? If we find something unusual and not feeling in unknown, then you start thinking, you dig into it and try to find out that hidden treasure. And that is what basically in science we understand and we do it. I think evolution already talked by Dr. Surendran here. He mentioned about Sushrita, the first ophthalmologist. Then Celsus, during Roman Empire, he wrote the whole books. He was one of those. And then Egyptian here, El Hatham. In fact, of course, we know about all these from Jacques Deviel, who gave the extracapsular surgery, and von Graffi and IOL, and we know FACO. I think all these people, they had an immense contribution. So as far as the science of ophthalmology is concerned, we are all very lucky. We work in a field which has a dual satisfaction. We do both surgery as well as do the medical part, as well as we treat everybody from a neonatal period till the last decade, all the way. That is something beauty of ophthalmology. Of course, we all know about this. I'm not getting into this, that majority of the diseases which we treat, they impact the elderly most, but the refractive errors, probably refractive error industry is so big, many people, they just survive on that. I think Ma'am Nachia talked about the neurological problem. We are the one, we diagnose many neurological and systemic diseases, first of all. So I think it's a great branch. And ophthalmology is something which you can practice solo. You can have a single specialty, subspecialty, just practice. And you can work for a big corporate hospitals or a other organization like what was mentioned about the Chitrakoot and Arvind Eye Hospital. At present, majority of the residents are women. I think this is a great thing. Everywhere you find, we have, because this is rewarding, as well as your personal life. There's a flexibility, convenience. That's why probably women are more and more into this. And the earning potential is immense. It depends because how much volume you get. I would just talk about, since I was supposed to talk about my philosophy, my first 13 years of life were spent in a remote village of Himachal Pradesh. This was in a very primitive school. You know, I belong to a very poor, illiterate farmer's family. those who were very hardworking. And that time my area was really very much backward. And I am the eldest of the 9 siblings. And I would fetch grass for the domestic animal, wash clothes, cook food. Even when I was just a little boy, wanted to help my parents. But I think this did the biggest thing for me, because this appreciation of my hard work by the villagers motivated me to do more and more, and I would indulge in more. And that appreciation helped me to work hard, as well as that was the initial period when I never knew anything about the life. I would walk barefoot in those hilly areas to school. Only in winter we'll get one shoe because it used to snow there. My parents were very keen that I should become a doctor or healthcare personnel. We never used to see a doctor. I have not seen a doctor during my childhood. There used to be some kind of a person who was not a doctor, like an in-between person who would go give injection, like, and do things. So they wanted, and that people used to fall sick and die. And most of our relatives and family friends discouraged me to take this medicine because they thought it is a very difficult branch. I am going from village. What will I do? But I knew that running water never flows back. I have to fulfill the promise of my parents. So I left no stone unturned. Here are my parents. I lost my father in 1993. My mother is still there. And my journey with ophthalmology started in Government Medical College, Simla. In 3rd year only, I thought I'll take up ophthalmology. And that was MBBL. Can you imagine? I left the radiology seat in PGI Chandigarh and competed again to get ophthalmology. And as far as my journey in retina is concerned, I did comprehensive ophthalmology with special interest in retina for almost 13 years. Because that time, that is the way it used to, and we used to refer from all over the cases to Shankar Netralaya, Chennai for all vitreoretinal surgery. The major breakthrough for me came with a fellowship which has been mentioned by NAM in University of Maryland, and that is where I was. And I owe a lot to these people, especially Dr. Vinod Lakhanpal here, Stanley Shockett, who's Shockett shunt and Shockett depressor, and Mark Preslin, who taught me ROP that time here. I'm here, standing here in front of the university logo. Well, friends, I would also quote this Robert Frost, because this is very apt for me, the way I took my life subsequently. 2 roads diverged in a wood, and I took the least traveled, and that has made all the difference. So my philosophy was that I helped to establish, along with Dr. Gupta, I got such a great mentor, senior teacher. We established first-class vitreoretinal unit, world-class in Chandigarh, and nobody would go from there now later on. And I took the least traveled road of ROP, and that changed my life at least. The most powerful draw for me on this was childhood blindness. It became a biggest passion, mission, and obsession for me, and I became totally focused on this almost in the last 30 years. And my journey started with ROP in 1989 in Baltimore, and subsequently in PGI 1991 onwards. And that time, ROP was one para, like retrolental fibroplasia, as a differential diagnosis of retinoblastoma. That's it. And it never used to happen in our country. And he is my contemporary, 6 months my junior in PGI Chandigarh for residency, Dr. Lingam Bhopal. He came in 1990 to USA. I was doing fellowship. He said he started seeing some ROP. Better concentrate on that. And this is subsequently, we met in, we have grown old. He is 1 year younger to me. He looks old even here. So I was very lucky to be in a place that was the first neonatal center of the country. PGI has trained the 70% of the neonatologists for the entire country. These great people here, they are the fathers of neonatology in India. That's how I could do all this. And I was lucky to have a strong role model who led by example. Nobody else, right from Professor Jain, and then they provided all the opportunity. And they were full of innovation ideas. We always moved together. And the team spirit was the highest priority. That is what we believed in. I don't know how we had to sit like this. This never happens. This was never planned. And I was never supposed to. Our Professor Jain, our teacher, then subsequently, that's how we became the chief of our center. It was never planned, but it happened. Here is my professor from Simla, Professor Sofat, who supported me a lot. And here is young Dr. Garewal, where I work these days. It happened somehow, and it had to happen. I'm so grateful that we had a great mentors. You can see them, how much they have done, how much they have contributed. During my entire career, 90% of the thesis residents were on ROP. I dabbled into research, and also I tried to kind of coordinate. These were the two papers back to back by me and Gopal in 1995. This was also my first thesis given in 92. And this is, I would like to cite, Anand Vinekar, who's known world over. He stayed with me for 6 years, trained with me. He came for ROP only. This has maximum number of citation among ROP studies from India. Already citations are more than 100 for a ROP paper. Can you imagine? And this paper led to change even in guidelines for Indians to 2 kgs, and also changing what was in the American guidelines. We would have missed so many cases. I think I was fortunate to do few things for the first time, treating babies through the wall of the incubator, which was published, and also propagating for first time that we can use the same laser, because we can't afford a separate laser diode. It's the same laser we use for diabetic retinopathy, for other things. And that is what we published first in 2010. And everybody now uses a green laser for. This is something which I am very proud. This is described by us from our center. This will become part of a classification, which is a process going on at this time, international classification. This is a new thing which was not described. So is this posterior zone 1. This also will be part of the international classification. This was towards end of my career. No, there is no exclusive study of a half zone or a posterior zone 1. And of course, I encouraged a lot, and Anand especially, to have something cheap. Look at the cost here otherwise, 80, 90 lakhs to 15 lakhs. And I think it works very well. It is available, it is affordable, and we can do a lot of things with this. Of course, when I was about to retire, I think to my name would be, if people start doing it, all nasal vitrectomy like this. You put a cannula, sit on the nasal side, put cannula right into the center and operate from 2 sides, especially for entire detachment which comes temporally up. You don't sacrifice a lens here. And the reasons for the epidemic in India are very well known. I'll not delve into that. We have the highest preterm birth in the world. We use oxygen, as well as these are some of the things we wrote an editorial for this in Indian Pediatrics. And my philosophy has been always to associate with professional bodies, with all kind of people around, as well as organize conferences and workshops. And I'm lucky here, father of ROP, Michael Tracy, is here. Anand also trained with him. He is the Michael Chang here. You see, he's been our friend. He's now the present director of National Eye Institute. And of course, here we have a lot of people with whom I could interact. And I was even a judge along with Michael Tracy and other big people selected just because of my work. Even till recently, you can see I was the only one from Asian countries talking about middle income group country in March. And well, I have been a member of the National Task Force by Ministry of India, and I have given 225 lectures. Most of the task force members are here, and we have formed the AIOP society. It made me the president. Dr. Natarajan is also here. This was the first when I took the first ever symposium, International Held by Vitreoretina Society in Hamburg, Germany. And you can see all the stalwarts there. I, of course, spoke on ROP, and others also spoke on various other things. So I published 54 papers, trained a lot of students all over. Even my son today, he's a vitreoretinal surgeon, and he is in PGI. He also does vitreoretinal surgery and uveitis. He somehow doesn't love that much children. He says, Dad, I can't do ROP. And this was the full issue of the journal, which was published. There is something to do with PGI and ROP, I must say. I think all of us are from PGI, and these are the ROP major people. I think you can see here that somehow it had to happen. We had to train in our institution, where I was trained, I became head of the department. I get bothered about this 1.5 stage. And I must say here, I have worked all across the country. And because of this, every place where I was invited, I never refused, just to educate, just to prevent that blindness which is seen here. Well, friends, I'm finishing here the challenges with the same thing which was also earlier mentioned by from Robert Frost by Dr. Surendran. And I thank all of you for patient hearing. I think among these galaxy of speakers, I've been so fortunate that I've been given, and especially on a Dr. Nam's name, whom I have always adored. And as I'm thankful again for giving this honor to me. Thank you, sir.